Welcome to this month's edition of Medical Minute. I'm Chastity, your host, and February is American Heart Month, and today I'm joined by cardiologist Dr. Laura Murphy to discuss heart disease, the risks, the factors, and what we can do to keep our hearts healthy. Thank you, Dr. Murphy, for joining me today. How are you?
I'm great. Thank you for having me.
Good. So can you give us a brief overview of what is heart disease?
Heart disease can encompass many things, and we have a nice, huge heart model here. It can encompass any part of the muscle, the valves inside the heart, the blood vessels, specifically the arteries that go to the heart, or the heart's electricity. If any one of those become damaged over time, or you have a genetic defect that becomes apparent over time, any of that can be considered heart disease.
What are some of the common warning signs of heart disease?
So the most common problem that everyone worries about with heart disease is the risk or the symptoms of having a heart attack. And some of the warning signs of having a heart attack are the classic chest pain. Some have shortness of breath when they exert themselves that worsen over time. Others can just feel like they're not doing what they usually did 3 or 6 months ago, so they feel very fatigued or tired. So those kinds of things are for heart disease. Those can also spill over to heart muscle or heart valve problems. And electrical problems usually manifest, or we see the symptoms of fast heartbeats, or they could have too slow of a heartbeat, which is usually the symptom of dizziness or lightheadedness. Also feeling weak.
So what signs shouldn't a person ignore if they're having some symptoms?
Any of those. Okay. Any of those that I just mentioned. Any chest pain or pressure that lasts more than 2 minutes, especially if it repeats itself with exertion, any shortness of breath with exertion, any funny fast heartbeats that last up to 2 minutes or more, any dizziness, lightheadedness as well.
And I know that women can experience heart attack symptoms differently than men. Can you talk a little bit about the differences between heart disease in men versus women?
Yes, specifically you're speaking of coronary artery disease, which is blockages of the arteries that develop, can happen as we age. Men develop this around 10 years earlier than women as far as the aging process. There is also the effect of premature disease in patients who have a genetic predisposition for that. But for the most part, men usually happen about 10 years earlier than women. And men usually have the typical symptoms of chest pain when they exert themselves. And if the heart disease, specifically the blockage of the arteries, worsen, then they can actually develop chest pain at rest or even shortness of breath. Women tend to feel more tired at first. They can't do all the things they want to do. They're usually the multitaskers in the house, and they can't multitask anymore as much as they wanted. But they can also get short of breath and not realize it, not do the same things they were doing 3 months ago to bring out that shortness of breath.
Okay. How often should someone check their blood pressure or cholesterol levels?
Different for different folks. When we start in our 40s or so, we should at least check it yearly if it's normal, or more often if it's not. If you're on medications, you want to yourself check it at least quarterly in the year. You don't have to check it every day unless it's uncontrolled, and then you work with your doctor as to how often you check it, if it's going to be more than quarterly. But if it's controlled, you can check it quarterly.
You talked about genetically people can have a predisposition to heart disease. With somebody who has a genetic disposition, what are some steps that they can take to improve their heart health?
All of the steps that everybody can take.
Okay.
So starting in your 30s and 40s, you want to make sure you know your numbers. Know what your baseline blood pressure is. That's a blood pressure that's taken after 10 minutes of rest. And if it's elevated, you want to do that 3 separate times in about a week's time. If that's still elevated, you want to see your primary care doctor. What do I mean by elevated? The American Heart Association and American College of Cardiology use the number 130 over 80. Other organizations are a little bit more liberal, but I'm going to stick with 130 over 80. As far as cholesterol, you want to check it when you get into your 40s, even earlier if you do get diagnosed with high blood pressure earlier, because things kind of go hand in hand.
Right.
So you want to make sure you're checking it earlier. And then you go over your values with your primary care doctor and find out what good level is for you and what you need to do.
Let's talk about lifestyle changes a little bit. So I know that there are lifestyle modifications you can make to diet and exercise to lower your blood pressure, to lower your cholesterol, and lower your chances of heart disease. Can you talk a little bit about some of those changes that people with concerns or maybe people with elevated blood pressures and cholesterol could take?
Yes. The best modification is to increase exercise and to use a heart-healthy diet. And heart-healthy diets are all over now. They're all over the internet. There are a lot of books on them. And they mostly deal with more of the whole food, less processed food, and that actually helps the gut as well. And then you want to just do a regimen that doesn't go over your caloric intake, and that's available online for your height and weight and where your goal weight is as well. So a lot of people who are trying to do heart healthy, if they also need to have a goal of weight loss, then they combine that together and usually work with a dietitian or even a provider, physician or an advanced nurse practitioner or a physician assistant to be able to achieve their goal. And the best thing you can do is to have regular visits to achieve that goal. And as far as blood pressure, the same thing. If it's elevated, they need to meet with their provider. Sometimes it can just mean a small weight loss amount that can actually bring the blood pressure down without actually having to start medications. Some people, not all, are salt sensitive. And people who are overweight tend to actually hold on to more fluid and salt. And as they lose the weight, they lose that fluid and salt, and they actually lower their blood pressure even more.
Interesting. Do you recommend people keep a log of their blood pressure so they can track it over time?
I do. Okay. I do. I like having logs, and there are all sorts of, again, the logs on your computerized phones and computers at home, and if you want to do the old-fashioned log on a tablet, that's great too. But I do recommend it because we're all multitasking, and our memories are not going to be what they used to be.
That is true. And are you comfortable if somebody just buys a blood pressure screening machine from a drugstore to monitor their blood pressures? Is that generally sufficient?
It is. And the way that you make sure it's sufficient is you coincide it with checking the blood pressure at your pharmacy or at your provider's office, and make sure that the blood pressure that's medical grade is the same blood pressure that you're getting on your monitoring machine that you have.
Okay. You talked about multitasking, and I know that we all multitask and live stressful lives. Is there any correlation between stress and the heart and heart disease?
Yes, there is. Yes, there absolutely is. It increases adrenaline, which is our fight or flight substance in our body, increases cortisol, which is another type of flight or flight, but that's considered a hormone. And both of those are elevated in stress, and both of those can increase the development of blockages of the arteries. They can also lead to the muscle weakening called heart failure. So if extended periods of time with those, yes.
Do you have any stress relieving techniques that you recommend to patients to reduce stress?
Well, there are all sorts of ones out there. Whatever fits for you. If regular exercise is really the best thing to decrease stress. It sounds kind of nuts because you're actually increasing your heart rate during that, but you're actually conditioning your heart. You're forgetting about the stressors, and you're concentrating on what you're exercising. So there's that. And another big de-stressor that I like are pets. Yep, pets of all kinds. Of course, the classic dog or cat is what most people do recommend, but whichever one works for you. Some people like birds, but to me that's a lot of work.
So what pets do you have?
I have dogs.
I have cats. If you could give one piece of advice for maintaining a healthy heart, what would you say?
I would say keep up with exercise past your 40s. Don't stop because you hit your 40s and you're multitasking, and know your numbers.
Awesome. Where can people find more information or resources?
Interestingly enough, the American Heart Association has a public-friendly website that has all sorts of tips. It has tips from heart-healthy diet to heart healthy exercise, to de-stressing examples and exercise examples that also de-stress besides losing weight. They also have losing weight programs that you can look at and work with your provider with. So I recommend the American Heart Association website. There are other websites probably out there, but that's the one I'm most familiar with.
Okay.
Because I actually volunteer for the Go Red campaign,
Okay.
which is what Heart Month started out from.
We have just a few minutes. Do you want to tell us a little bit about the Go Red Heart campaign?
Sure.
Okay.
So Go Red is a heart campaign that increases awareness of heart disease in women, as well as increases the access that women need to get heart health from their providers, and it also has provided more research for heart disease in women.
Awesome.
Those are the three goals that it's had. It's been here since 2004. In the first year it was out, over 1,600 general public ladies were actually interviewed, and they took a little survey, and literally less than 20% of them even knew the classic symptoms of heart disease or stroke, and now over 2/3 of them know because they were retested in 2020.
That's amazing.
Also, heart attacks and deaths in women were happening about once every 60 seconds in 2004, and that has decreased to one in about 80 seconds when it was last calculated in 2020.
That's awesome.
So it has provided an impact.
Thank you. Thank you, Dr. Murphy, for joining me today on Medical Minute. We are going to conclude. We hope that you join us next month for March Colorectal Cancer Awareness Month.
Thank you.
Thank you.
Thank you.